How do I decide whether to have Invisalign or orthodontic treatment with braces? This is a question that I get from patients all the time. It's a topic that we discuss at almost every consultation. Currently, we're able to do pretty much everything that we can do with braces with clear aligners, with Invisalign. So a lot of times I give patients the choice and then they have to decide. So there's all these great things about orthodontic treatment with Invisalign, and then there's one catch. So let me tell you all the good stuff and then I'll tell you the hard part. So number one, and my favorite thing, is that you can remove the appliances, you can remove the clear trays that Invisalign has, so you can brush and floss your teeth properly. This is really important to maintain the health of your teeth. There's nothing worse than going through orthodontic treatment, taking the braces off, and finding a bunch of cavities or a bunch of issues or damage to the teeth. The teeth are straight, but then they're not healthy. What's the point, right? So this is one of the things that Invisalign helps with. You can brush and floss properly. Number two, you can eat more things. You have more freedom with what you can eat. It's not as restrictive because you're taking your trays out to eat and you can just eat like normal, pretty much like normal. Number three, if you're an athlete, you play sports, it's a lot safer. So if you have brackets and wires on your teeth and you get hit with a soccer ball in the mouth, the lips and the cheeks are going to get smushed into those brackets and it's not pretty. But if you're wearing aligners, essentially you're wearing a double mouth guard, top and bottom, so it makes it safer for your teeth while you're playing sports. Another benefit is that it just looks nicer. That's not really the main selling point, but it's something to consider, especially if you're a teenage girl and you're a little bit late to get braces and all your friends have already had their braces and you don't want to kind of be the one person who doesn't have braces. It can help boost your confidence and it can help you just feel better about yourself as you're going through the process. So that's something that parents often take into account. Another benefit is that the appointments aren't as close together. So you don't have to come to as many appointments, which is more convenient. Orthodontic treatment with clear aligners can also be monitored remotely. There's different applications that are used where the orthodontist can check in and can see how the treatment is progressing and can make modifications remotely. So for example, I have a patient that just moved to Lebanon for a year for an unexpected family reason. And I gave her enough aligners for a year and she's sending me pictures so I can tell her, hey, wear the rubber bands this way, do this, switch trays. You can also remote monitor treatment with braces, but there's more possibilities with aligners. We talked about convenience. It's also convenient because there's not as many things that can break and it's more comfortable. So you don't necessarily have issues with pokey wires or broken brackets. So in general, patients tend to have a more positive experience with their aligners. So are you ready for the catch? The catch is that you have to be compliant at wearing the aligners. I tell patients that fixed braces are on your teeth 24/7. You just need to wear your aligners 20 to 22 hours so we can be successful. That's it. If you can do that, then you can have the same outcome as with braces. That's the key. It requires that extra degree of compliance. And when I'm looking at especially moms have this instinct about their kids, and the mom will know immediately, like, hey, this is going to be a good fit for my child can handle this, or they'll immediately have this like reaction and they'll say, nope, that's my kid has glasses, we lose the glasses half the time, they've lost or damaged their phone, this is not a good fit. So moms know their kids best, and I really rely on the mothers to help me make that decision and to direct the course of treatment, whether we go with fixed appliances or with Invisalign. In our practice, the cost is the same, so cost is not a factor. The time is usually the same, and if it's not, then we discuss it and we discuss all those pros and cons. It's a conversation we have every day. If you have any questions or concerns about Invisalign treatment, I would be delighted to meet with you. I'd be delighted to consult and see whether Invisalign is an appropriate treatment for you, whether that would help you achieve your goals. Please give us a call, and I look forward to meeting you.